So let me introduce our speakers for this evening. Rituparna Basu first became involved with the Ayn Rand Institute, I believe, when you were in high school. Is that right? So she started learning about the philosophy and ethics of Ayn Rand as a high school student. Ritu specializes in the application of Ayn Rand's philosophy of rational egoism. And those of you who have attended our conference and have heard Yaron Brook speak probably know what rational egoism means. And if you don't, you probably will know when you leave here tonight. Her particular focus is on healthcare policy. Ritu's work has appeared in Forbes.com, Town Hall, The Daily Caller, other publications. She's been interviewed on several radio programs across the country, including NPR. She frequently speaks on college campuses, so we'll have to get her to make a return trip to Colorado to speak at some college campuses around the state. We would love to have her do that. This is her first trip to Colorado, by the way, so we're glad she started with the best in Steamboat Springs. Ritu is also a graduate of Penn State University, and she's an alumna of the Ayn Rand Institute's Objectivist Academic Center. So let's have a round of applause for Ritu. Our second speaker and panelist this evening is Dr. Jill Vecchio. Jill is a board-certified radiologist specializing in women's imaging. She currently practices in the Denver metro area, so we were fortunate to have her close by to be able to make the trip up here today. Jill has read the entire Affordable Care Act, so if you have any questions about it, she will be able to answer them. She actively works with federal and state legislators around the country on healthcare policy and issues, does a lot of speaking around the country. You also should check out, Dr. Vecchio has developed and recorded a 7-segment YouTube video series, which is easily available on the internet, reviewing the Obamacare law, including the judicial, constitutional issues, and ideas for real, honest-to-goodness healthcare reform. Dr. Vecchio also co-hosts what has become a very popular radio show in the Denver market, which you can also hear on the internet. It's called Heart of the Matter. It's with a group called the Americhicks, one of whom is with her tonight, Molly Vogt, who's with Americans for Prosperity, another really great conservative public policy group. Their show airs Sundays from 4 to 6 p.m. on KLZ 560 AM, also known as Grassroots Radio. As I said, if you haven't, or if you don't get 560 AM out here, which we don't, you can listen on the internet. And also, Americhicks, their radio show just went national this last week, so it's really catching on. So really happy to have both Dr. Vecchio and Molly here tonight. So let's give a warm Steamboat welcome to Ritu Basu and Dr. Jill Vecchio.
Okay. Should I just start? Yeah, okay. Can everyone hear me? Yes? All right, good. They told me this would automatically turn on. Is that okay that there's 2 of them? We're good? Okay. When I found out that this event was titled, I thought the title of this event, Imagine the Power to Choose Your Healthcare. I thought that is a great title. I definitely want to be part of this event. Because I think it really names a key value that is being threatened in America today. And that is our ability to choose the best healthcare for ourselves, to make the healthcare choices that we think are in our best interest. Now, in my comments today, and we only have 5 to 10 minutes each, so these will be very broad comments, and hopefully we'll have a good Q&A so you can follow up. I want to focus more broadly. Losing our ability to choose the healthcare that best meets our needs is one issue. I want to talk more broadly about what I think is a major problem in healthcare. And then I want to give an indication of why we keep doing the same things over and over again, knowing that they'll create the same kinds of problems. So what is destroying American healthcare today? And I do think American healthcare today is being destroyed. And given that we know what that is, why we keep doing it? So why do I say that American healthcare has a lot of problems? I mean, this is not a very controversial issue, right? I mean, everybody says, yeah, healthcare in America has a lot of problems. It's why we got Obamacare. It's why we've got a lot of other government programs, because people think, yeah, healthcare has a lot of issues. If you just think about something like Obamacare, what were some of the problems it was supposed to be fixing? Well, you had real problems, like health insurance premiums kept going up and up and up, continually rising. Over the last decade, health insurance premiums have gone up 100%, have doubled. And this is unusual if you compare other costs for other products. If you compare to car insurance or life insurance, your premiums are not rising, and not nearly as much. If anything, they're going down. And it wasn't uncommon to see your premium, your health insurance premium, go up 10, 12, 15% every single year. And that's not sustainable, and that's a real issue that we have to deal with. American healthcare has problems, right? People have had a lot of problems finding coverage. Before Obamacare, one of the reasons that they said we needed Obamacare was, well, look, people are not able to find coverage, and it's kind of this bizarre situation because at some point you have coverage, say you have it through your job, and then you leave your job, and then all of a sudden you can't find coverage. And that doesn't really make much sense. So American healthcare has a lot of problems. Everybody agrees. But what are we supposed to do about it, right? That's the debate. Now, I think that what most people think is the problem in American healthcare is not the problem in American healthcare. And we saw this during the Obamacare debate. What were all the problems in America's healthcare market attributed to? They were attributed to, we don't have enough regulation in this market. We don't have enough government control of healthcare. There's too much freedom in healthcare. So insurance companies, the reason premiums keep going up and up and up is because, well, they're free to jack up their rates, right? I mean, nobody's stopping them. They're going to pursue their profits, and everyone else is going to get screwed. Insurance companies are free to fleece us, they said. Or they said, well, the reason you can't find coverage, well, insurance companies, they're free to just turn you away. They're free to refuse you. If they think you're too expensive, they'll just not give you coverage. So the problem was, they said, that there's too much freedom. We need more control. In reality, the opposite is true. The truth is that American healthcare has been mostly controlled by the government for decades prior to Obamacare. It was one of the most controlled industries in America before Obamacare. And one way to just think about this is if you look at how healthcare dollars are spent in the United States. So before Obamacare, 45 cents of every dollar that was spent on healthcare in America was spent directly by the government. So the government's spending it through entitlement programs like Medicare and Medicaid. And as we know, he who pays the piper calls the tune. So everything, anybody who's getting their healthcare through Medicare, through Medicaid, government is calling the shots. Calling the shots for you in terms of the kind of services that the government will pay for, the quality that will be available, how much the doctors can charge for their service. I mean, everything the government is controlling. The other 55 cents, right, 45 cents directly spent by the government, 55 cents, and that number, of course, after Obamacare, that 45 cents, now it's a lot higher, way over 50 cents, is being spent directly by government. But the other 55 cents, well, that's the private market, right? That's what they say is the private market. It's employers, it's health insurance companies, it's patients spending out of pocket. And that's supposed to be the private market. But in reality, it's private in name only. I'm going to stick with the example of health insurance because that's what Obamacare is about. That's where most of our problems are right now in healthcare. But health insurance companies, there's nothing they can do without government permission, without government dictating to them exactly how they're going to do it. So who they sell their policies to, what kind of policies they sell, how they price them, where they sell, how they advertise. Everything is controlled by the government and was this way for years and years and years before Obamacare. And if you trace this out, if you trace out the problems in American healthcare, and this is a big task, what you do see is that the problem is not that we have too much freedom. The problem is that we have way too much government control. And I think in the back there, I saw some of you with copies, there's a paper that I published earlier this year, published by the Pacific Research Institute, and I take health insurance as an example, and I show how controlled this industry was before Obamacare, and the problems that, of course, resulted from that. So what's hurting American healthcare, what's holding it back, what's destroying it in many, many ways is the fact that government controls almost every aspect of it. And Obamacare is the greatest government control in almost 50 years. So it adds a further layer of control. And the question is, and the question I think you should be asking, is why do we keep doing this? If government control is what is holding back American healthcare, making things like insurance really affordable, making things like insurance difficult to find, doing all sorts of other things. I mean, we've got critical shortages of doctors in this country, nurses, drugs. I mean, we have all sorts of problems. And it's all happening in the context of that American healthcare is very, very controlled. Why do we keep exerting more control over the healthcare market? Right? If controls broke the system, why are we trying more controls? So now part of the reason for this, right? Part of the reason for this is the fact that people were told, and this is what everyone is always told, that, oh, we have a free market and that's clearly not working, it's clearly causing all sorts of problems, so we need the government. That's what we were told before Obamacare, that's what we're going to be told when the next big proposal comes along, that look, we've got too much freedom, which of course is not true. But there's a real goal that I think we need to be wary of in terms of what is behind, what are proponents of government control of healthcare, of increasing government control of healthcare, what are they after? Because if we don't reject this goal, we will continue to keep making the same mistakes. American healthcare will continue to be plagued with problems, and we will become like Canada, like the United Kingdom, and there are already talks to adopt those models in the United States, though Obamacare has just been implemented. And if you want to know why we shouldn't become like Canada or United Kingdom, ask me in the Q&A. So what's driving this? Why do we keep exerting control over healthcare? Well, I'm going to stick with Obamacare. So there's not a big secret why we needed Obamacare. President Obama said, we have a moral imperative. We have a core ethical and moral obligation that we as a society are not fulfilling. He said, I am my brother's keeper. I am my sister's keeper. So whatever Americans are doing, he said, we need to put that aside because there's something that we as a society are failing to do and that we're morally obligated to do. Now, what was he talking about? Well, he was talking about the fact that before Obamacare, there were a lot of people who could not afford their health insurance. There are a lot of people with pre-existing conditions, they could not find coverage. They used to have coverage, but now they don't. These people, Obama said, they want health care. They need health care, they want health care, and they can't afford it. And now it's the rest of society's job to figure out a way to pay for it. Now, if all you wanted to do, right, because these were real problems before Obamacare. It was a real problem that insurance premiums kept going up and up and up, and people were having so much trouble finding coverage. These are real problems. And if you wanted to deal with them, if you wanted to fix them, all you have to do is see, well, what's causing this? And what's causing this is government control. Repeal the control, you fix the problem. Done. But that's not what happened, right? Because the goal here was not to fix the problems. The goal was to fulfill this core moral obligation. It was to bring about a society in which if your neighbor can't afford his health care, it's your job to pay for it. It's your responsibility to pay for it. It's your duty to provide him that health care that he needs, can't afford. It's your job now. And if that means, and it has to mean, right, if your job is to pay for other people's health care, for someone else's health care because they need it, of course that means that you can do less with your money, right? So if you have certain goals, priorities in life, say if you want to start a business, you want to save for that, well, that of course has to be subordinated, has to be sacrificed for the needs of others. That's what it means to be your brother's keeper, to be your sister's keeper, to be your neighbor's healthcare provider. And that's what Obamacare, in all how many pages?
2,732.
2,732, plus all the regulations coming out of it, more than 2,000 pages, that's all they're trying to achieve. They're just trying to create a way by which everyone in this room, everyone in America is fulfilling what is seen as a moral obligation to pay for other people's health care if they cannot pay for it. And how this is happening, I'm running out of time here, so I'm going to ask me in the Q&A, but it's really, it's interesting. Every control in healthcare over the last 50 years has been motivated by this goal: to ensure that people are upholding their moral responsibility to sacrifice their own interests, their own desires in life, their own priorities, their own dreams, in order to provide the health care to others. Now, this is not a proper goal. This is the wrong goal. It's an immoral goal, and it is an un-American goal. What does it mean to say somebody else is entitled to health care at your expense? It means that you now are not an individual with the right to pursue your own happiness. You are a servant to other people, to the needs of other people. And this is exactly what the Founding Fathers fought against. Right? I mean, every society, every country before America was founded on the idea was your life does not belong to you. Your life belongs to the state, your life belongs to society, your life belongs to God. And the Founding Fathers said, no, your life belongs to you, to pursue your own happiness, to pursue your own life, your own values, your own goals. A society in which other people's needs are a claim on your time, on your efforts, on your life, on your earnings, that is not a society in which you are free to pursue your own happiness. And of course that means that your choices are sacrificed, that your life is sacrificed, your ability to get the best care for yourself is sacrificed. That's the point. Sacrifice is the point. Sacrifice of your life, of your happiness for the needs of others. And that's not the society that I think that I want to live in, and I don't think it's a society that anybody should want to live in. Thank you.
Yeah, just put it on 10, but I'm not going to use 10. So you need a techno brat here to set my timer so I won't. It's hard to get out of that nice soft chair. Thank you all for being here so much. I tend to wander about and use my arms in big ways, so it's not safe for me to be near a podium. I'm going to talk about the doctor-patient side of this argument, although I'm going to reiterate some of the things that Ritu said because her points were perfect. How many times do we hear, but everybody has a right to health care? Okay, I always say the first thing you should ask in return is, what do you mean by a right to health care? Do you mean you have a right to pursue health care? Sure you do. Does that mean you have a right to free health care? No. Does that mean you have a right to expect somebody else to pay for your health care? Do you have a right to exactly the same health care as everyone else? Those are all very different questions. So the first thing I would say to you if someone brings that up to you is, what do you mean by free health care, or a right to health care? Because if they say they have a right to free health care, then that means they have a right to reach into your pocket, take out your money to pay for something that they think they need, or they may want, just want to have. Okay? The other thing it says is, to me as a physician, if you think you have a right to free health care, that means that you think you have a right to my skills and knowledge. Nobody has a right to my skills and knowledge, okay? And nobody has a right to anything that your skills or knowledge for whatever it is that you do either. Rich talked about this as well. Part of the problem with the system is that because of government interference over the years, we have created a system whereby the person giving the service, healthcare, the provider and doctor, and the person receiving the service, the patient, are separated bureaucratically from the person paying for the care, whether it be government or private insurance. That in and of itself is a distorted system that is not free market at all. Free market is you and I coming together and you sitting in the room across from me, and we interact. We agree with what I'm going to do for you, what you will in turn give me as remuneration. If I choose to do something for you for free, that's my choice. Okay? What you choose to pay for your services is negotiated between the two of us. That's any kind of a free market. When you go to a grocery store, you know, do I want the organic? Do I want Chiquita bananas? You know, it's kind of, you weigh your own value system with whatever you are choosing to pay for a service and that sort of thing. So you get to make all these decisions yourself. No one is forcing you to make them. And if somebody said, oh, well, Jill, just go shop and, you know, I'll write a check whenever you're done. That's what we have in healthcare. Go ahead, go shop and get that MRI. Go for it. The more you use, the more you're getting your money's worth. Come on, you're an American consumer. We know how to use these things. That's part of the problem with healthcare. When somebody else is paying for it, I'm going to Saks, right? Government can only control costs in healthcare through rationing care, limiting your choices as a patient, limiting my choices as a physician on what I can offer you for services, or by decreasing the amount of money they pay providers, doctors, physical therapists, hospitals, that sort of thing. So government can only control costs through taking things away from us. I would put to you, and we're going to talk in the next segment, we can control costs much better, much more effectively, and much more symbiotically by working together and getting someone else, the government and the insurance companies, out of the picture as much as possible so that they're not even involved in our decision-making process and our negotiation. This kind of, I had an epiphany a few weeks ago. Tell me if you agree with this. Government somehow has a way of taking an unlimited resource and turning it into a limited resource. Ronald Reagan said beautifully, if it moves, tax it. This is the way government works. If it moves, tax it. If it keeps moving, regulate it. If it stops moving, subsidize it. And that's exactly what's happened with our health care. So we came from, years ago, there were a certain number of doctors for a certain number of people in a community. If there wasn't enough doctors, then the community could recruit a new doctor to come in. Doc Hollywood, has anybody seen that movie? Really cute movie. Yeah, it's an old movie, but it's cute. Anyway, it's kind of like, so the community could recruit a physician, or if there was a glitch of physicians and they didn't have enough patients, couldn't have, you know, the lifestyle that they wanted, they might go somewhere where a physician was really needed, and they could, you know, the market will even itself out. So really we had an unlimited resource in a lot of ways, because people would be willing to pay for CT scans or pay for x-rays, and they limited their own care. They limited their own utilization of health care by making these decisions that we as consumers make every day everywhere else. The government, on the other hand, is going to make decisions based on populations, societies, studies, resources. The government limits, did you know the government limits how many medical students are admitted to medical school every year? It's because it's paid for by Medicare Part B. At least in part, it's paid for by Medicare Part B. Am I right, Dr. Wheel? Yeah. So whenever you have the government in charge of it, now they're going to limit the number of physicians that are going to turn out every year. Doesn't happen with law school. That's why we have so many lawyers and not very many doctors. Also, we're working on a doctor shortage of about 10,000 docs per year. About 25,000 or 35,000 are leaving the practice. That was before the health care law, Obamacare, was passed. Now it's much higher than that, but 35,000 left every year, 25,000 graduate from medical school. So we've been working at a 10,000 physician per year deficit for several years already. So government has created this limited resource, healthcare should have been an unlimited resource, was an unlimited resource, the market limited itself, and now they've turned it into a limited resource by not controlling people's, I should say, by incentivizing people to use more and decreasing the reimbursement. So they've decreased supply and increased demand. So they've created a limited resource. Now, when government creates a limited resource, it's not always by accident, in my opinion. If there's a limited resource, then it must be controlled. Okay? So when we have a limited resource, i.e. healthcare, now the government gets to step in and say, we have to control this. Same thing, think about like fracking. Think about natural gas. Wow, now we found out we have these incredible stores of natural gas. It'll be interesting to see how much the government decides to step in and turn a potentially unlimited, virtually unlimited resource into a limited resource. I gave a talk a few weeks ago about kind of a moral approach to healthcare, and I went back and read through the Hippocratic Oath. So every doctor, well, most, I think even some medical schools aren't even doing the Hippocratic Oath anymore, which is really sad. CU still does, that's where I was. We had to take the Hippocratic Oath the day that we graduated, all together, or you weren't a physician as far as CU was concerned. So you had to do that or you hadn't really graduated. I went back and read through the Hippocratic Oath, the one that was kind of in the era when it's been changing over many years. Part of it said, I will treat the patient as an individual. I respect life from conception through infirmity and death. I will make decisions with my patient and for my patient based on what's best for that individual patient. The government, on the other hand, makes decisions based on populations. They look at studies, they collect data through electronic health records. So they collect data and they analyze the data and say, wow, the best way to treat this is with this. So, doctor, you need to use that because our study showed that this is what's best. No, my personal experience has shown in this community with these patients, with their concurrent other medical issues, with their habits, with their lifestyle, with their community and environment, that this is a better one. No, you can't do that. No. This study showed that this is a better drug. You know, which is a better way to do it? Governments treat populations. The other thing in the Hippocratic Oath that struck me was there's a whole section talking about patients' privacy, the secrets that our patients impart to us as physicians. That we should hold those sacred, never to divulge them ever. And if we did, essentially, may we just, lightning strike us dead on the spot. And if we kept our patients' secrets private, then may we thrive in our practices. So now we have electronic health records. We already had the all-payer database in Colorado, and they've proven that some of that data, they were able to, in what, Molly, was it 80% of cases? Some huge number of cases, 80% of cases, this redacted data where supposedly the identifying features had been removed, that they could be reconnected with the patient. Now we've got national, everybody has to have their electronic health records. Last time I went to my doctor, somebody came in who I didn't know, sat down at a table at a laptop computer, just typing while he and I were chatting. We had a much shorter conversation that day than what I would normally have had. Think about what people will and will not tell their physicians. Things that physicians are being required in some cases to ask of their patients and then to record that. And then to record that so that somebody in government can potentially go in there and say, oh my, you had depression? Oh, you're not getting a license for a firearm. Wow, 15 years ago, I don't care. You guys are having marital problems? You talk to your doctor about some marital, no. This is really frightening how this information can be used, and believe me, whenever there's information like that, it's going to get abused. These are some of the things that concern me as a physician that are making my my job, just seem like so overwhelming at this point. I can tell you that personally, the people that I know in healthcare, I've never seen the morale so bad. 5 of my partners are on, since Obamacare passed, 5 of my partners have decided they're on the track to retire. So, this is, needs to be addressed, and I think we can address this. I think we can absolutely do it from a free market standpoint, and I think we can do a whole lot of this without even involving government at many levels. Just do it. So we can talk about that in a couple minutes. But we did want to have question and answer. Bright lights. Oh, that's much better. You're a quiet crowd. Come on, folks.
If you guys want to just continue, then that's fine.
Do you want to do you're doing this next one first? Is that right?
Yep.
Okay.
So this next part is supposed to be talking about solutions and reform. And I'm going to try to make my comments short because I did take a lot of Jill's time earlier. But I do want to highlight something that, part of what I said was that if some people are entitled to medical services paid for by others or provided by others, that doesn't just mean that someone like me, I'm not a physician, right? So I have to pay much more for my health care, for my health insurance, for example, in order to subsidize older people, to subsidize sicker people, all sorts of things, because that is seen as my moral responsibility. But the producers of health care, they are sacrificed even more. So as Jill talked about some of the consequences, some of the things. So the fact that government controls healthcare today, controls almost every aspect of it, what that means is that it controls doctors. It controls their time, right? Electronic medical records are time consuming. I think there's a lot of doctors in here, so let me know if it's the fastest thing in the world and you love it. Nobody? Okay.
That's why I'm late to this.
Oh, okay. See? That's at least one reason not to have it. There was a great op-ed in the Wall Street Journal last week. If you haven't read it, I really encourage you to read it. It's called A Doctor's Declaration of Independence. It was written by this doctor in California, I think Santa Barbara. His name is Daniel Craviotto. I don't know if anyone might know him, some of the doctors. Anyway, he's an orthopedic surgeon. And he wrote about all the different ways that the government has increasingly come to control his livelihood, control the medical profession, control his time, control his efforts, control his earnings, controlling his life, essentially. So electronic medical records is one. Just the fact that you can't act on your own judgment. You think there's a treatment that's good for the patient? No, you cannot exercise that. The government is going to decide. That is part of doctors being sacrificed, doctors being seen as they don't have a right to pursue their own happiness, to conduct business on their terms, to practice medicine as they see fit. They don't, just like I don't have a right to pursue the best health care for myself, because it's not about the individual, it's about you sacrificing for other people. So I just wanted to point that out. Now in terms of the solution, right, my solution, and I think the goal should be a free market. And free market means no Medicare, no Medicaid, no Obamacare, no S-chip, no regulation of health insurance companies. The government only exists to punish fraud, punish force. So if you have a contract and somebody violates it, an insurance company doesn't uphold their end of the bargain, doctor says they're going to do something and they don't do it, and these are complex issues, but for force and fraud, nothing else. The government's job is not to redistribute my money to other people. It's not the government's job to redistribute your wealth. You have a right to use it as you see fit. Now, the free market is the right solution for two reasons. A, because as I indicated earlier, government regulation is what has broken our healthcare system. The reason we have so many problems, the reason costs are so explosive, I mean, the fact that it's just not a very pleasant experience. There's no Steve Jobs of healthcare. This is commonly acknowledged. There's no Steve Jobs of healthcare. There are great men and women in healthcare, no doubt. But I can't think of a Steve Jobs in healthcare. That's a problem. This is not a place where doctors want to necessarily be. So many of them want to retire soon. There's all sorts of problems. Government regulation broke it. We need to deregulate. We need to move towards a free market, treat healthcare as a business, let it be run like a business. The profit motive is a good thing, and you can ask me about that in the Q&A if you want. And the second reason that the free market is the solution is that it is the only system in which each individual's right to pursue his own happiness is respected, is preserved, is protected by the government. So anything besides a free market, any government control of healthcare, on the view that healthcare is a right, that your need to healthcare entitles you to what belongs to others, that's not what a free market is about. It's the only system in which you can pursue your own happiness. If you want to help other people, if you want to go pay for somebody else's health care, do it. But other people are not entitled to your efforts, and that is what it means, right? When the government comes along and says, now Peter is going to pay for Paul's health care. I'm going to make sure this happens. I'm going to tax him. Peter has no choice in the matter. Right now he's paying for Paul. What that means is that Paul is entitled to Peter's money, to Peter's life. On a free market, that's not what happens. You engage with people when it's mutually beneficial, and when it's not mutually beneficial, you seek greener pastures. Now, this would definitely make healthcare a lot better. I mean, if healthcare was run like a business, if it was deregulated, of course, certainly it would be a lot more affordable to a lot more people. Things would not be as expensive today. And if there are people who, maybe of no fault of their own, can't afford their health care, well, it's still their responsibility to figure out a way to pay for it. They can ask friends, they can ask family, they can appeal to a private charity. Before the welfare state, there were mutual aid societies where people would come together for events that one person couldn't pay for on their own, and there are all sorts of different ways to handle your medical care. But it was all on the premise that medical care is your responsibility. It's not the responsibility of your neighbor. And that's what a free market preserves, which is why we should hold that as the goal. And now maybe we can talk about some concrete proposals about how to get there.
And a lot of these, most of these I already discussed in the YouTube video series also. It's like 11 or 12 minutes long. It's number 7, the last one, Health Reform Ideas. The rest of the series was actually done in like December 2011. So some of it's dated, but a lot of it still really holds true, and it's kind of frightening how much of it has actually come to pass over the last couple of years. It's kind of frightening that we were right. There were a lot of people that were right about this. Couple of things. So one of the things we want to do, if we're going to decrease the cost, overall costs of healthcare, we need to decrease the cost to providing care. Physician overhead, about 40, Mike had a very lean, Mike Fallon had a very lean operation, so you were like 5% or something of your overhead was from coding. But I don't know if y'all know, we have this coding, CPT coding, ICD-9 coding. When you look at a doctor bill, you're going to see 2 sets of numbers, a whole lot of sets of numbers these days, but 2 of the numbers are going to be, one is going to be your diagnostic code, saying diabetes or whatever. The other one is going to be your payment code, or a code that will say, this is justifying this test that we did, or this prescription, whatever. So you have these 2 numbers. They need to match up at the insurance company or at the government. And if they don't match up, if a decimal point is off, if they're not quite right, they're going to send that back to us and say, we're not going to pay you. So this whole process, and it becomes a song and dance. The insurance companies, some of them automatically shove a whole bunch of them back at you, even though they're correct. Why did you refuse this claim? They say, oh, well, no, that was a mistake. Okay, we'll pay you after all. I mean, it's the same song and dance that goes on. Am I moving around too much? I need to behave myself. that's what the coding is. Well, so anytime there's a code that has to be issued, or a code that's being used, we have to figure out that the code exists, what it means, how we can use it. If we use it improperly, either overcharge or even undercharge, we get charged with fraud. Medicare, Medicaid, fraud. So nobody wants, well, you don't want to mess with the codes. So we hire people to do these codes. And that's maybe their full-time job. We have 2 people with our radiology group of about 27 docs. We have 2 people whose full-time job is coding. So salary, benefits, all that. Our group is somewhere around 30 to 40% of our overhead is dealing with regulations and coding. We also have people whose only job is to try to keep track of regulations. Understand that all the piles of paper you hear about or see pictures of that are coming from Obamacare, they don't send you an email saying, woohoo, got a new regulation you're going to want to know about. Honestly, there was a regulation that for reimbursement for this kind of breast imaging we do, mammography kind of thing. The regulation came out in January. Nobody in Denver knew about it until April. So we were billing, everybody in Denver was committing Medicare fraud for 4 months. Until we found it. You've turned us in already, I suppose. It does. Absolutely not one physician, not one provider could not be accused of fraud if you wanted to go after it. And now in this healthcare law, they're going to go after it. So anyway, that's one of the things. We want to get rid of the coding. It doesn't serve any purpose. It virtually serves no purpose other than paperwork and a way for them to deny claims. States right now have what they call healthcare mandates, health insurance mandates, and now Obamacare has its whole set of mandates. All the coverages that would mean that I, at 55 years old, have to make premium payments for maternity coverage and pediatric dental and vision and all this other stuff. So things that I will never use. So each one of us, if you're paying premiums on a private insurance policy, every one of you is paying for things that you will never use so that somebody else can use it. What's that about? Why can't I just have a policy that I say, okay, I want ER coverage, I want hospitalization, I want catastrophic coverage, and the rest of it, really, I'll take my chances. I'm going to save money in a health savings account over here, and I have a good living right now, and we have stuff saved up. I'll take my chances. I don't want to pay premiums to cover things like substance abuse, and those, of course, Obamacare really does go all the way through that I might need that coverage. But otherwise, let's pick and choose what coverages we want and what we don't want, what we're willing to pay for, what we're willing to take a chance on. Now, if you take a chance on it, you get it, then you pay for it. You pay cash, okay? Your responsibility, but you think about what we have now where older, sicker patients are only paying 3 times, they can only pay up to 3 times the amount of premiums as a young, completely healthy person. Well, these guys are going to use a lot more than 3 times the health care that this young kid is going to use. So why are the young kids not getting the health insurance? Because it's overcharging them. And they're undercharging these people. Now, what's going to happen with the system in 1 or 2 years? The insurance companies are going to go, wow, none of these young healthy people are in our risk pool that we expected to have in here, even though they're going to be penalized for not having health care. Now all we're covering is older, sick people. Well, now we got to raise the premiums because we're losing money here. So those premiums are going to skyrocket in a year or 2 years, whenever their re-enrollment periods come up. So we have no idea what is going to happen yet. The employer mandate, all that stuff is going to fall apart. So I say get rid of those mandates. Get rid of the coding, get rid of the mandates. In my opinion, that'll take your costs down almost 50% right there. There's no reason to have them. Health savings accounts with catastrophic coverage, so that the majority of healthcare, something like 85% of healthcare that is consumed right now is outpatient, non-catastrophic, non-hospital healthcare. 85%. So really, we only have to get coverage for 15% of the health care. We only really need, and you know, it's a fairly small part of the population that's using that. So what we've done is completely destroy our entire healthcare system, which is going to in turn destroy a great deal of our economy. But we've completely destroyed our healthcare system for a very small percentage of people and a very small percentage of healthcare that's delivered. Let's even that out by having these health savings accounts. And let's imagine that when you're born, you are issued a little insurance. You get your very own insurance policy that follows you throughout your life. Doesn't have to be the same company, but as long as you have continuous insurance coverage, you can never be charged with pre-existing conditions. If it weren't for insurance being tied to the workplace, pre-existing conditions would be a very small issue. But now that it's tied to the workplace, the minute you change your job, now you have a pre-existing condition. Sometimes you can't get insured. So if you had a little policy that followed you from all your years and adjusted for whatever kind of happened a little bit along the way, but you could never be denied coverage, that's the answer. And then you have a little health savings account. So you put money into that health savings account little by little by little. As you go along, you could accumulate as much money in that HSA as you wanted to. It can only be used for healthcare expenses. Let's say you pass away at age 50 and you've got $100,000, $200,000 left in your HSA that you've never used. You could donate it to charity. You could pass it on to your heirs. Only be used for healthcare expenses. You could literally, if that's what you did, over time you wouldn't need Medicare. You would need charity care for only a small number of people that really truly needed it. Now granted, a bunch of people have paid into Medicare, so that's created its own problem. They spent all the money that we paid in, it's gone already. So, you know, the government has totally screwed up the Medicare system, and a bunch of us are going to be left without it. But I see that as a huge answer to the ongoing problem of healthcare expenses. Keep the insurance companies and the government as far out of the decision-making process as possible. Allow flexibility in how physicians practice. Right now, there are many instances where physicians aren't allowed to accept or to give free care or unreimbursed care. Did you know that? We're not necessarily allowed to give free care. We cannot negotiate prices in most instances. If we have a Medicare patient in front of us and whatever service we're rendering to them is covered by Medicare at some level, then we don't have any flexibility in negotiating any prices with them. We certainly can't charge them anything extra in spite of the fact that we lose money about half the time on Medicare patients. We always lose money on Medicaid patients I've never even heard of an exception. I certainly haven't seen an exception to that. So allow doctors flexibility. I have a friend that's a lawyer and he does a lot of DUI cases. Well, a lot of his clients don't necessarily have that money. It's a chunk of change, I guess, when you get a DUI. Thankfully, I've not had to deal with that. But so some of them, you know, they'll get him lawn chairs for his pool or something because that's what, you know, maybe they're in the business, or, you know, new tires on his car or something. But you could barter services. You could give pro bono services if you chose. You could, there's a acupuncture massage place in Boulder where you come in and it's all, government has nothing to do with it, there's no insurance, but they say when you come in, they say, okay, you know, if you're willing to put in a little bit extra, then we'll be able to give free care for some of our other patients. Are you willing to do that? And most people are like, sure, I'll put in another $5, $10. Yeah, go ahead. And I said, they're not forcing you, they're just saying, would you mind just kicking in a little bit and then we can take care of some other people, and you know, we do some stuff for free, but we'd like to make it up. I mean, it's like the people will work together and help one another under these circumstances. Medicare and Medicaid. Now I want to hear what you have to say about Medicare and Medicaid, how you could do that also, because I think block granting Medicaid means that the government already knows they spend a fairly set amount of dollars at each state for their Medicaid. Medicaid is under 65 roughly. Medicare is over 65. Medicaid, indigent people, changing now. But anyway, the government and the states share the expenses of Medicaid. So the government could send whatever amount of money they anticipate, or some percentage of whatever they sent the year before, to the state. Like Colorado could get a chunk of change from the Fed. It's our money anyway, right? And then the state can decide what they want to do with Medicaid. There are all kinds of neat ways to deal with Medicaid patients. Some places are doing health savings accounts for them with a basic catastrophic policy. That way these Medicaid patients they have to manage their own money and make their own decisions on health care. They're much less likely to use the ER under those circumstances. So there's some really neat things that can be done with allowing people to manage their money, taking it back down to the state level, because everything's better at the lowest level of government. I must be doing something. Oh, I got a battery problem. This does, anyway. I'm actually, I was a cheerleader in high school, so I can talk really loud if I need to. Anyway, so those are some of the ideas, but block grant Medicaid, I honestly don't see why you can't block grant Medicare. They just have to figure it out, but wouldn't it be nice to completely dismantle Health and Human Services? Have it just be like, okay, here's the money, you got that from Colorado, here's a check for Colorado. You know, I'm going to lunch now. We spend, do you have any idea how much money? It's like $200 and some billion just on salaries and benefits for the people in Health and Human Services. $1 billion, not a single patient is cared for with that money. Where does that money come from? And we're borrowing it. I'm not the only one that's paying this. Everybody in here is. You can all raise your hands too. Right, so a whole lot of money is being wasted. The more levels of bureaucracy it has to go through, the more money of ours, the more of our money is being wasted, and nobody's being cared for. Bureaucracy, government bureaucracy exists only to feed itself, only to procreate more bureaucracy. Okay? The bigger your budget, the more important you are as a bureaucrat. You know, it's time to kind of interrupt that. Quit feeding that plant. It's like that, what was that play? Feeding Seymour. Feed me. Little Shop of Horrors. That's right. Yeah. I think churches and private organizations should handle charities. That's the way to take care of the vast majority of indigent people. That's the way it was always done. Always done before. No reason it can't work again. And if you think, oh, well, Americans are just, we're not going to give. Really? Baloney. You have any idea how much money is donated? How much was it that went to the tsunami? Didn't Americans send $100 million or something of private donations for one event across up on the other side of the world? And you're telling me we're not going to take care of our people? This is what, I don't know, I have a big thing about thank you. People receiving things from government don't have to say thank you to anybody. Nobody. So that's what becomes this attitude of now you gave that to, so now you have to keep giving it to me. Now you need to give me more. If they had to turn to a taxpayer, look them straight in the eye and say, thank you, I needed this. How different would our world be? Would we say, you can't have anything. We're not going to give you anything, or we'll say, we'll help you out right here. We'll help you get back up on your feet so you can take care of yourself here. This is what America was built on. That's what made us great. That's what will continue to make us great. But when we depend on this anonymous handout, in my opinion, it destroys the symbiotic relationship of charitable giving. Which Ayn Rand, what does she call that? It's like the selfishness of...
Sorry.
Ayn Rand called it the selfishness of something. Do you remember that? Where it's like, even though we give, that actually we receive significant, we feel good. And then you can't put a price on it, but you feel good when you give to help somebody else. So it is a symbiotic relationship, and there is a selfishness about it, because we still gain from that relationship as well. Those are the main, do you want to talk about some more? I'm kind of blabbing on and on. Yeah.
Are you ready to take questions? You want to hand me that microphone?
Sure. While you're getting some questions, I can say one more thing. Right now, employers get a tax break they get to deduct the cost of premiums that they pay for their employees, but if you're a sole proprietor or an individual, you don't get to deduct those. cost, the premium costs on your taxes. So obviously that needs to be evened out as well. So there are a lot of tax issues that would actually be in the realm of the federal government, but otherwise the federal government needs to get out of the healthcare business altogether, take it down to the state and local level, and the interaction between patient and doctor.
There we go, okay.
I wondered about this concept in terms of would it also provide an alternative for the alternative situation. There's a hospital in Texas that is a private hospital. It's divorced itself from the system entirely. The doctors have their own group. They have their own insurance policy. I would assume they have also their own equipment. Wouldn't it be a good solution for doctors and hospitals to negotiate and work together and form their own group outside of the government and charge fees according to what service is rendered rather than what the insurance companies dictate?
Absolutely, and that's why I said earlier, I think that we have, like Yogi Berra said, when you come to a fork in the road, take it. But we have two ways to go. We can go socialized medicine, which is Obamacare, that is meant to turn into a single payer. It's meant. It was written, and you could tell I could tell when I read it, it's meant to collapse the entire system so that it'll open the way for a single payer. That's all it's meant to do. And it's so far it's doing a good job, but thankfully for elections, it's going slower because they don't want to do some of these things before the election year. The other thing is going a free market route. And you know what? We don't need the government to do that. We can do that ourselves. We have concierge docs that are really innovative in some of their practices, and no two are alike. They're all a little bit different, and that's the American way, right? Let's have as many different experiments in what works best for communities, individuals, doctors, patients, providers as possible. There isn't going to be just one answer like the government seems to think there is. So that's exactly right. Let's get doctors, hospitals, providers. Unfortunately, there are very few, in my opinion, hospitals that have not bought onto this, because they stand to gain a great deal of control over patients, control over doctors through the PPACA. So it's going to be doctor-owned hospitals. Of course, PPACA also put a kibosh on a lot of the doctor-owned hospitals. There is a grandfathering on that.
This question's for Ritu. One of the discussions we had this afternoon at lunch was your impression of the Canadian system and the system in London, because we hear this all the time. Oh, but they really do have a great system. I just want to hear your comments that you shared with me this afternoon.
Yes, I could definitely share those. Are you going to be sitting? Although if you're standing, I'll stand too.
I don't know. I wander around a lot.
Okay.
I'm just antsy.
Yeah, I mean, so people want to be like Canada in the United States. We have this strange fetish with Canada. We want to adopt the Canadian model. Canada has what they call single-payer healthcare, which means private insurance companies are, kicked to the curb. The government is paying for most medical services. And in the United States, we have forms of this, right? Medicare, Medicaid in a lot of ways, the Veterans Administration. So we have a lot of parts of our healthcare where the government is paying the medical services, and a lot of people say, yeah, now the government should be paying everybody's medical services, not just the elderly, not just the disabled, not just low income, but everybody. And you don't have to look very hard at the consequences of this kind of system. So Canada has had socialized medicine for decades, and I think there's a real tendency, if you live in America, and this was my, anybody, I felt that this way too, is that, well, people tell a lot of horror stories about Canada. They tell a lot of horror stories about rationing, about the fact that you need to wait 2 years for an MRI, whereas here you could get it in a week, 2 weeks, maybe 3 weeks tops. There's horror stories, there are people dying waiting for care. So last month, or in March, I actually went to Canada for an event, and I had a real chance to talk to people in Canada about their experience with the healthcare system. And what the biggest realization for me was that These are not horror stories. This is their daily way of living. Most people there have to wait an immense amount of time to get care. Just get something as basic as an MRI, right? So not even getting treated, just trying to figure out what's wrong with you. That means, sometimes it could be 2 years. The average wait time to see a doctor in Canada is more than 2 months. Here, it's around 3 weeks. So this is time spent waiting in pain, your economic productivity is affected, your whole life is affected. This is not a system that we should want to emulate. And people there are used to it, they're jaded about it, that's just the way things are. And if America goes down that route, we will also become jaded. I mean, in a lot of ways we have become jaded. If you take a program like Medicare, Medicare will be 50 next year. A lot of people like Medicare. Seniors like Medicare. Okay, that's fine. But what's the alternative to Medicare? What would freedom in healthcare have produced? What are the choices available to seniors? Would healthcare be cheaper? Would they have a greater range of options for treatment? I mean, these are all real questions. People don't ask them, and they get satisfied with whatever they have. That's what's happened in Canada. So if you ask the average Canadian, do you like your healthcare system? Yeah, I like it. But then you ask the Canadian who gets really sick, who can't get treated, who's put on a waiting list, and he's told, listen, you've got to wait because this other person needs this operation more than you do, so you've got to wait. Because again, the point is sacrificing your own interests, your own desires for other people. And so, I mean, I never take anybody seriously, never really take anybody seriously who says that Canadian healthcare is good. You go there, you talk to the people, you hear their experiences. These are not horror stories, these are routine things, and it scares me to death that we are moving in that direction.
It's kind of amazing how, unfortunately, how insidious it is that people forget how to be free. Have you read the book Up From Slavery? Booker T. Washington? Where a lot of the slaves are, when the slaves were freed, Emancipation Proclamation, the Civil War was over, and they're dancing around and partying for a couple of days, and finally they stood around and looked at each other and went, what do we do now? And some of them went back to their slave owners because they didn't honestly, how do you do freedom? How do you be free? And I think you're absolutely right. We have worked our way down or allowed ourselves to be told and convinced that the only way, the only solution, this is such a big problem, healthcare, there are so many externalities, only the government can do this for us. And it's just such a load of bunk. I think we just need to retrain.
I absolutely agree with both of you that putting free market back into healthcare is what can save the healthcare system in this country and bring down our cost curve. We've talked about uncoupling employment from insurance, getting the government out of Medicaid, which has turned into a horrible second-tier system in this state and nationwide. At the risk of never being able to get a job again in a hospital, my concern is also from the provider standpoint. We have 20% of the economy, and it's about the only product that is delivered in this country that you have no idea what the price is going to be when you purchase the service. When somebody comes to see me and they say, hey doc, what is this going to cost? And they're trying to be a good consumer, I have no idea. The hospital doesn't list their price, drug companies don't list their price, other providers don't list their price. And they end up getting these bills for $50,000, $100,000, $200,000, $300,000. So if we're talking about consumer-driven behavior, the provider side of this equation is just as much of a problem as the payer side of this equation. And where do you see any change or possibilities in that? Because I think that is just as big of a problem.
It's so funny. I didn't mention post prices, did I? It's at the top of my list. Every single time I talk about healthcare reform ideas, posting prices, I skipped right over it on my list. I so apologize, because that's crucial. And, you know, it kind of drives me crazy when a patient will say, gosh, did you see, I got this bill for $100,000. This is outrageous. So the patients are outraged at the size of this bill. What so few of them actually look at, and what nobody wants to talk about, is only about 10% of that is ever paid out. 90% of that. Pardon?
Unless you don't have insurance.
Exactly, unless you don't have insurance, and then,
It's the worst market, it's the least able to pay, who has to pay the most, and that is where the system is found.
exactly. And if you if you go to your doctor's office and say, I want to pay cash, how much is this in cash? Oh, well, it's $100,000. It's like, no, it isn't. How much is this really? And they kind of don't know what to do with you. Keep asking them, though. Keep asking your doctor, okay, what does this really cost? How can I negotiate this? Because the more people that ask them, the more they're going to start going, well, maybe I should start thinking about this. If people are asking me, wow, maybe I really need to figure out, most of them don't even know what it costs them to provide care. Like a hospital would not be able to calculate for you the actual cost of a month's worth of MRIs, because they've never had to do it before because it just didn't matter. It's ludicrous. Every other business knows what their costs are.
I just want to
Thanks,
add,
Mike.
price transparency is this artificial problem, right? Because on a market, in a free market, like, this is not exactly a big issue. It's not like I don't know the price of an iPhone or an iPad. No, these are mostly unregulated markets. And obviously, if consumers want to know price, which is not a crazy thing to want to know how much a service or a product costs, obviously producers are going to want to give that information, right? So it's not like it's a real big problem today, but it's precisely because we don't have a market. But I think it's purposeful that there's no price transparency, because the whole point in healthcare is you shouldn't be thinking about the price, right? You're entitled to healthcare. It doesn't matter how much it costs. Somebody will pay for it. Sometimes, unfortunately, they ask you to pay for your own healthcare, which is annoying. But, someone will take care of it, and you're not supposed to worry about it. So surprise, surprise, nobody posts their prices.
And it's a whole game. It's different. The price is going to be different if you're Medicare, Medicaid, insurance. What insurance? Do you have a copay? We've created this totally screwed up system that nobody can really navigate or figure out.
We are the last civilized industrial nation to get national health care. For example, Switzerland, which is a very capitalistic country, has had health care for years. I would like to ask the two of you, I've really not heard any statistics from you. According to these other nations, how long do we each live? I don't think, when you look at the statistics, that we are on the top.
That we are off the top.
We are not among the nations where people live the longest.
Oh.
Every civilized industrial nation has national insurance.
Right.
Medicine today is large and complicated. When Ayn Rand was alive, it was not that expanded medicine. Things were not available. I mean, during this, penicillin didn't come until after the Second World War. Ayn Rand predates that.
Okay, well, let me address that.
Give you some statistics here. Are we living so long in the United States without national health care?
I have one of those numbers cold right now.
All right, that's what we do.
So
I'm going to inject. If we go by the longevity, these are the two biggest things that have been shoved down our throat for the last 2 years about health care. That we rank 37th in infant mortality. They rate 36th in longevity. We had shoved down this because, like in France, for instance, the per capita expenditures for health care in France is about $4,700 a year. Germany is about $5,300 a year. The U.S. spends about $7,900 a year. So we look very costly compared to these systems. But none of these correlate at all with longevity. If we were to use that logic, then why do we spend as much as they do in Vietnam? You know that we live 6 months longer than the average person does in Vietnam. Do you know how much they spend per capita on health care in Vietnam per year? $169. okay? China spends about $300 per year per capita for healthcare. So longevity is not at all correlated at all with what we spend. It has nothing to do with the healthcare system at all. There's two major factors into it. The other one is infant mortality. You know, we rate 37, you know, that puts us between Egypt and Cuba. Ask any nurse that works over at OB in Hampton Valley whether they would realistically ever want to have their kid in Egypt. Seriously, okay? The problem there is that this was all published in the 2003 World Health Organization report. That's where all this data comes from. And guess what? There was a 4-point grading scale to grade each country as how well they're doing healthcare. Now, 25% of the grade was for FF, financial fairness. And guess what the score is on a 100-point scale for the U.S. in financial fairness? The UN, which is who published the study, gave us a 0. We could have run a perfect score on the rest of the healthcare indices. We would have a 75 out of 100 scale point and have a C on that grading scale. Exactly what happened. Most countries do not record an infant that doesn't live past their first year as a lost infant because it was considered a non-viable fetus. We count everything, all of our preemies that are born under 2,400 grams. We count all of them. We don't count them in Cuba, we don't count them anywhere. So where do you think our infant mortality numbers will go?
Right, so the point is that life expectancy does not necessarily say anything about a particular healthcare system, right? I mean, we get into more car accidents than the Canadians do. We're fatter than most other nations. Obviously, that's going to cause issues and make make healthcare more expensive here and all sorts of things. So I don't hold life expectancy as some sort of goal to try to achieve. And if you look in terms of innovation in medicine that has actually elongated our lives, America is top in innovation. So there's no even comparison. I do not want to live in Switzerland, and if you do, please move. I just don't. I mean, it's easy to sit here and talk about, well, Switzerland, Canada, United Kingdom. Go live there, see if you want to do it. Because I think you're not going to be willing. But the other thing is to put, and this is put all the time, is we're the only civilized nation where healthcare is not seen as a right, though it is. It's seen as a right in a lot of ways. Medicare, Medicaid, Obamacare, everything in healthcare is based on healthcare is a right, the notion that healthcare is a right. But yeah, we haven't socialized it completely. That is your definition of civilized? To treat some people as if their lives don't matter, their happiness doesn't matter, their goals and priorities in life doesn't matter, their priority in life, their duty is to sacrifice all that for other people? That is not a civilized society. That is a dog-eat-dog society. In America, the reason we do not have socialized medicine is because we have resisted that view more than other nations. Not completely, obviously, but that's the reason why we have not socialized medicine completely, and I take that as a virtue, not a vice.
Yeah, I recently met with one of the deputy healthcare secretaries from Japan. He was in the United States for 5 months, trying to find out, wow, what did Obamacare do that we didn't do in Japan, because they have a national healthcare system, the government insures everyone. Physicians there, until they can work their way into a private practice, but the physicians there, the majority of them will see about 100 to 150 patients per day. Each patient they see for 2 to 3 minutes. Patients who don't have appointments, they are piled up in the waiting rooms. And this was all verified. I did some research on this, and I verified it with this Japanese official, government official. Their healthcare system is falling apart. Because the physicians see so many patients and have so little time to spend with the patients, they prescribe a lot of meds just to get over the hump, just to make up for it. The emergency room visits are out of control. There are patients that will actually go to the doctor 2 and 3 times a week. I mean, it's just this bizarre system. And he did a tour of the facility, and it was a private facility that had an outpatient surgery center with an overnight stay, and the room was nice and big. And so he walks into this room where a patient would be after surgery for a day or two, and he's looking around going, how many people do you put in this room? And we said, 1. How many people do you put in this room? 1. How many people would you put? 5? But I mean, it's unbelievable what we take for granted and then what other countries are taking for granted. And most of these socialized systems have to have some private aspect to their system in order to make it work, because you can't do 100% socialized medicine. Hold on.
We need to wrap it up since we're right at 7 o'clock, so why don't we ask each of you to make a 1 to 2 minute closing statement to kind of wrap things up. And Ritu, would you like to go first?
Sure. I mean, so what I hope that you take away from this, from my portion of the comments, is that the problem plaguing our healthcare system is a really, really bad idea, a really corrupt idea, a really immoral, un-American idea. And it is the view that you are your neighbor's healthcare provider, that your job in life, your moral responsibility is put the needs of other people above your own. That's not what America's about. That's not what I think anybody should feel guilted to do, to sacrifice their own goals and dreams in life. No, you should want to achieve your highest potential, and any government control that gets in that way, you should be very, very angry, and you should fight against it.
I would say that we treat healthcare, we've kind of been taught to treat healthcare like it's some totally different beast than any other consumer industry in this country. It has been turned into a beast by government and insurance companies and interference and regulation, but it doesn't need to be that way. I don't know how to fix my own car. I'm going to go find somebody. If my car has something wrong with it, I'm going to take it somewhere. I may take it to 2 different places, get another opinion. I'm going to take it in and say, okay, this is what's going on. Take a look at it, see what you think. Okay, he looks at it and he says, this is what I think is wrong, this is what this is what I'm recommending that you do, here's what it's going to cost. I look, nah, do I really have to have that? No, you can probably wait on that. Okay, so let me do this, this, and this is how much it's going to cost. Okay, here, go ahead and do the work. I don't know how to fix the car myself. I do my homework to find a good place to go. I trust him to do his job. If there's something wrong, and the car doesn't work the way it's supposed to, I go right back to him. I look him in the face and say, okay, how are you going to make this right? I have been wronged, how are you going to make this right? There's no reason that we can't do health care the same way. Yeah, it's complicated. If I go to Mike Fallon, he's an ER doc. If I go to him, I don't know ER doc, and I don't know ER medicine anymore. Even as a physician, I can't give a truly informed consent to Mike Fallon. So it's like I'm trusting another doctor because I don't know everything he knows. There is no way. People say, oh, you can't treat healthcare this way because people will never understand. Baloney. We make all kinds of complicated decisions about our lives, what to do with our lives, what to do with our health, what foods to eat. If you know about nutrition, holy smokes, really? Healthcare supplements. So, no, we shouldn't expect to know everything about healthcare in order to take it back so that we're making our own decisions about it. So I would just say that we can do a lot of this on our own, the free market transition, because no government is going to give up this power. We have to start doing it on our own, and we can do it.
All right, let's hear a big round of applause.